Dr. Rupesh is with me here for this particular video on a discussion on how corticobasal implants are patient-friendly. It is indeed a pleasure, Dr. Rupesh, to have you with us here. And we've been working together for more than 25 years, or 30 years now. We've touched 30 years. Yes. And so we are just having a discussion on how corticobasal implants turn patient friendly. How are they patient friendly?
Yeah. Once again, a very good day to all of you. In fact, in the previous episode, Dr. Prasanth had explained to us what are the major difference between these two implant systems, as we know of, the conventional implant to the corticobasal implant. And this is a discussion as to why one should probably go the corticobasal way, according to Dr. Prasanth. Now, to be very brief about it, it is called the corticobasal implant because this particular implant engages the hard or the outer hard
Cortex.
bone, outer cortex of the bone, and whereas the conventional implant engages the spongier part and waits for the bone integration to happen. And Dr. Prasanth also told us in the previous episode that one of the major advantages of the system is on immediate loading. The implant system can be loaded immediately, whereas the conventional system generally prefers a thawing period or a waiting period for the loading to happen. So I think in this episode, Dr. Prasanth, we should probably discuss the advantages.
Yeah, we'll discuss on the advantages of yeah. So we'll probably discuss this topic wise. There are a few topics as I've listed out here. So we'll go ahead with various topics in detail so that people are able to understand.
Yeah. So basically, for the common public, for our audience, the general audience who is our subscribers, probably you can tell us, on a series wise,
yes,
the patient friendliness of a corticobasal implant system.
Certainly.
So if you can go in a systematic manner, it'll be of great interest.
So the first point is quick fixation of teeth. That is immediate loading. The fixing of teeth within a matter of 3 days is something we are able to accomplish with corticobasal implants. Whereas this is not possible with the conventional implants. You can see this picture here. This lady came in with very bad teeth and all the teeth were mobile and shaky and wobbly. She had bleeding gums and a lot of other issues. So we extracted all those teeth and put in implants, installed implants and fixed the teeth. And that is the result. That is the post-operative orthopantomogram picture which is seen. Another very similar case where the patient who was a very apprehensive patient from Australia. So he never visited his dentist and all the teeth were very badly damaged. And we extracted all those teeth, put in implants, and then we could give him a fantastic smile. All this happened within 3 days. So this kind of a procedure is very often not possible with conventional.
So when Dr. Prasanth, when you speak about loading, you're not only speaking about aesthetic results, you're also talking about functional loading also.
Yes.
Meaning you're asking the patient to start chewing immediately.
We call it immediate functional loading.
Does it have any scientific reason behind this?
Certainly, yes. As I had mentioned in our previous video, why do orthopedic surgeons mobilize patients immediately after surgery? It is just that the loading should happen, the healing, the bone healing should happen in a loaded fashion. So what will happen? Based on the loads being exerted on the bone, the healing will be optimal and the right amount of bone, the right quality of bone is being formed during the healing phase.
Is it due to any bone stimulation?
Yes, bone stimulation happens. Yes, exactly.
So
bone stimulation happens. So whereas when you do not load the implant, there is no stimulation of bone happening. The stimulation happens only after the osseointegration phase of about 3 months. minimum. But here, when you immediately load, the bone is stimulated immediately, and during the healing phase, the bone builds up. This is what happens. That is the beauty of this particular science.
Yeah.
And so, as I mentioned earlier, patient just can't afford to wait these days. These are the days of superfast cars, buses, trains, and planes, computers. So there's no question of waiting. I still remember the old computers. We used to switch that on. We'll go have a coffee and come, and only then will it start working. But now we have really advanced computers. With all these computers, we accomplish so many tasks which we could never imagine before. And as I mentioned earlier, orthopedic surgeons, they fix plates and screws and ensure that patients start walking and functioning in the normal way without any delay.
They are made to.
They are made to
do it.
Yes, they are made to do
by
it
the orthopedist.
Yes, exactly. So that is the beauty. And so there's no question of waiting for 3 or 6 or 12 months, which is the case with conventional implants. And the normal treatment sequence in conventional implants is like this, which is being shown here. This is the normal bone situation, and the implant is placed through an open surgery, and then it is closed. The sutures are placed, and the implant is allowed to integrate. And after 3 months, the area is reopened, the implant is exposed, and the crown is fixed.
Yes.
So this is the normal course. And in situations where there is no bone, or when there is lack of good quality bone, they will definitely consider doing bone grafting. So in such a situation, like what is seen here, you can see very thin bone. So the grafting is done, and this grafting process happens, and it takes about 6 months for the graft to settle, and then you have to wait for another 6 to 12 months before the implant is placed and the crown is placed. So it really becomes a tedious, long process. Whereas with immediate load, as you can see here, the implant is placed, and then the crown is fixed immediately. This is these slides you can see the conventional implant placement, where it really takes time. But with basal implant placement, you can see the basal implant is placed and the bone builds up over that over a period of time. So that's what happens. Here is a case where there is a lot of bone loss. All the teeth were mobile and shaky, and we placed the implants. Within 72 hours, we've loaded the patient, loaded the teeth, and see the picture after about 2 years. You can see how beautifully bone is healed. The patient is doing extremely well. This is the pre-operative scenario, and this is the post-operative scenario.
Yeah. So I basically was about to ask Dr. Prasanth whether he has any documentary or documented evidence of what he just told me about. So how long have you been following up? How long a documented phase do you have?
I personally, I've been doing corticobasal implants since 2009. So we have, this is my 15th year in corticobasal implants.
Okay.
So we have thousands of cases documented, lots and lots of cases documented.
Right.
These are all 4 to 5 years old cases, which I'm showing here. So that is the beauty. And you can see this is a very old case of mine. You can see in this picture, the area where there is no implant, the bone appears very soft and porous. But where the implant is present, you can see the density of bone around the implant. The bone density is excellent because this keeps stimulating the bone. When the titanium implant is there, it keeps stimulating the bone. That is the beauty.
And you also told us, I think Dr. Prasanth also told about the bone compression also, the densification also.
The densification also
would play a part.
Yes. Even that will play a part. Yeah. Yes. So that is the first portion of the benefits of corticobasal implants. We hope you liked this video. If yes, please share the video. Please subscribe to our channel. Thank you very much.
See you soon.
See you soon.